Hello friends, how are you all? I hope you are safe, secure and under the cover because of our Indian Army. And today I am going to talk about capa tool as I promised yesterday to make you aware about the capa tool and its implementation in the concerned department. So, what is capa tool? Capa means CAPA. So, C means corrective action, preventive action. Corrective action and preventive action. It comes under the NQUAS, National Quality Assurance Standard capa tool. So, yesterday I talked about as a whole the NQUAS round which happened recently in our hospital by 3 assessors. So, we went under the round, so we are more aware now. So, we need to understand about the capa tool. It is one of the assessment tool by which we can improve the patient safety, the patient security and the better care to the patient. We can deliver better care to the patients. So, the first capa tool which we apply in our department, in the concerned department, that is the process mapping. What is process mapping? So, process mapping in the context of NQUAS, National Quality Assurance Standards, typically refers to the visual representation of processes and workflows with healthcare organizations to ensure quality and compliance. So, it is a tool. So, what is the purpose of the tool, capa tool, process mapping? The purpose is identify inefficiencies, visualize processes to pinpoint areas for improvement, as we all are very much aware, because in that feedback session by the assessors pinpointed some area of concern and some areas of improvement. So, we are very much aware that which area is need to be improved. So, they also pointed about that. So, this is the purpose of this tool. And number 2, standardize the procedures. So, we do the procedures, but here we have to standardize it. Commonly, usually we do it, but if we know the tool, then we can standardize the procedures and we can improve the patient's care. Then the third one is again enhance quality, ensure compliance with NQUAS standard, and we can enhance the quality of our care, quality of our work, and automatically in this way we can give the better care to the patients. We can enhance our standard as well, because we will use the tools and then we can implement our work. So, what are some steps of the process mapping? Map the current processes, document existing workflows, then analyze and identify its gaps, like they discussed in their feedback session, that these are the gaps and how can we fill the gaps, how can we improve it by some beautification of our work, by some placement of the things like the bins, waste bins. They talked about not to keep the bins, we should keep the bins in the area where the garbages are generated. So, the placement of some of our things, we can beautify, we can modify some process and we can deliver the better care to the patients, quality care in fact. Then the third is design improved processes, like there is gap. Now we already identified the gaps, so we design some improved processes, create new workflows, create new ideas, and we can implement it during during the discharging of our work. So these are some steps. Then I would like to give you some examples. Some examples from our department, because I am working in the post-op department. So from the post-op department, I am giving you some examples of capa tool where we use capa tool. So the patient flow mapping, mapping the patient journey from PACU. PACU means what? Post anesthetic care unit. So from the OT we receive the patient to our department. So in this on the way we will assess that where there is need of oxygen to the patients or oxygen administration to the patient or not. So if we map the process, then we then we go for the oxygen cylinders, for the availability of oxygen cylinder, whether it is filled up or not. So on the way we apply this process mapping, and we can do some improvement in the patient care, in the shifting of the patient during the shifting time. Just we use that transport the sliding board. So what is this? This is an example of the process mapping, because we mapped the process and we understood that there is need of the patient sliding board. So it is the better way to shift the patient from the patient's trolley to the bed. So it is another example. Then the next example is the pain management process. So how do we use the process mapping in the pain management process? We need to know what all drugs are already given in the intra-op. So how do we know that? We will, during the shifting of the patients, we can talk to the anesthetist, and we will know that these drugs are already given, these drugs are already given, and you can give this drug and you can inform me. So it will comes under the process mapping. In this way we can manage the patient's pain very efficiently, and this would be the great example of efficient work. Then the next is communication, better communication. So how do we use the process mapping in the better communication? See, anesthetist will come in our department with the patients. Usually they come every time. So we need to talk to them that yes, these drugs you already given, these drugs have you given or not. So how are the patient's condition, whether the patient is the hypertensive or the diabetic or any other serious conditions or any other specific disease are there. So we need to know about the patients, and it will not take much time to do the process mapping and we have to write down something here and there. No, just we have to be aware about that our patient is coming and we are available there with our gloves and all, and we will talk in between. During the shifting we can talk to them, and we will come to know that the patient is suffering from some cardiac diseases, or patient is this patient is diabetic or hypertensive, or heart rate was this and this. So in this way, with the better communication, we use the process mapping tool, and we can know about the patient. Then the next thing is we make the intake output chart. What is it? So it is the medication process, and we use the process mapping in the medication process. How? See, we make the intake output chart, we write down there, used to write down there the dosage of the medications, its frequency. How? and this is the 500 milligram, 1000 milligram, 40 mg, the BD, TDS or OD. So what is this? This is also one example of process mapping. In this way we come to know that this medication is to be administered at this time and how much its dose. So these all are the examples of process mapping. So I am sure it is very clear to you all about the process mapping in our department's procedure. Now I would like to give some example in the context of OT, operation theatre. See, in the operation theatre we receive the OT list. What is this? This is again an example of process mapping. How? Because in this OT these all are the surgeries are going on, and according to that we prepare the instrument set. This is again a process mapping. The process of sterilization, its packaging, its storage, so we know better. So we first we map the process that we have to do this for how do we package it, how do we pack it, during means how much duration we can keep it, how much duration. Actually usually we sterilize every day. So this is also example of process mapping. Then the medication management, intra-op, mapping the process of medication, ordering, storage and administration of medication in the OT. So you know what happened in the OT? Early in the morning the technician goes to the sister in charge and they receive the drugs. Why? To use intra-op, to use in the intra-op. So that is also another example of process mapping. And you know, if they will not map the process, then one by one the technician will go to the sister, to the senior nursing officer and receive the drugs after every patient. But they map the process early in the morning for after analyzing the OT list, that how many surgeries are there in my OT, whether this is GA or spinal. So according to that they plan the medications because they have experienced, and they go to the sister in charge, senior nursing officer, and they receive from there and kept it in the OT to use intraoperatively. So these all examples are of the process mapping. If you can take the example of ward, so in ward also the same, like intake output chart is there, you are vital signs, monitoring the vital signs, we use the multipara monitor, we use that vital signs chart. So what is this? This is the process mapping, because we need to know the patient's condition 2 hourly, 4 hourly, 6 hourly, and we do that. And what is this? These all are the examples of process mapping. So now is it very clear to you? I am sure, I think that it is very clear to you all, and now onwards we all will be very much aware about this tool, this particular tool of process mapping. Isn't it amazing? Isn't it very easy? Because we do every day the things, the process, the procedure, and in this way we get the error, we can check the error, we can analyze the error, where is the gap, is there the same medications, the same doses is administered or not. So there is already clear cut written in our intake output chart. So I hope this is worthy for you, that this is worthy information, and as I took responsibility to make our hospital aware about the capa tool, so for next 16-17 days I will be here regular, and in this way every day you will get to know one capa tool, its example, its application, how do we apply this capa tool in our department. So in this way you can connect it with your department. I am because I am working in the OT and post-op, so I gave here the example of OT and post-op. You can very much clearly, very easily connect to your department, and in this way you can make the capa book, and you can write down some examples connecting to your department. So thank you so much, and please watch this video and get the proper knowledge of capa tool and the process mapping tool under capa tool. Thank you all and have a great day.